Hello, I wanted to talk about another topic today. This would be my third lecture. What I have had a lot of conversations with some of the patients in my office recently and through the years actually about some of their concerns, especially when they let other people in their lives know what they're doing as far as their treatment is concerned. And for an example, if somebody were to go home and say, hey, I just got into a methadone clinic, or I got on Suboxone and I'm in a Suboxone clinic, some of the common responses that they may hear is that, oh, you're just trading one thing for another. You're just trading, let's say, heroin for another addictive substance like methadone or Suboxone. And so that there's somewhat of a negative connotation to what they're doing, or there's some misunderstanding there. And so I wanted to take some time to kind of go through what I believe is addiction and what I believe is dependence, and those two things are different, and kind of some of my thoughts regarding being in treatment with Suboxone or methadone. So the first thing that I would probably want to define is what is addiction and what is dependence. So if I were to take anyone in the world and I gave them a opiate like heroin, let's say I gave them heroin, let's say I gave them hydrocodone, Percocets, whatever, and I gave that to them repeatedly, regardless of who you are, your body will start adjusting to whatever I'm giving you. So your body's job basically is to readjust to anything that you're putting into your body. So when somebody gets on, let's say, heroin or Vicodin or something like that, their body is naturally, the biological process is to build a tolerance to that. And what is tolerance? Tolerance is something that builds over time when you continually expose your body to a substance. And it's kind of defined like this: if you have to use more of something to get the desired effect, then that would be a tolerance, meaning I have to use more now. If I want to go and drink alcohol and get drunk, maybe if I've drank every day for the past 6 months, now I have to drink 10 beers as opposed to what I used to be able to only drink 3 beers and 6 months ago and get drunk. Now I have to drink 10 beers to get drunk. So that's called tolerance, and that's a biological phenomena that we predict and know would happen regardless of who you are. The other physiological part that looks like dependence is that if I were to take the person, let's say, who's using alcohol, drinking 10 beers a day, and then I said, we're going to cut you off of alcohol completely, what would you imagine might happen? Well, I'm sure that you're thinking to yourself, I would imagine that person's probably going to maybe feel bad. And you would be probably right. He's going to start having withdrawal symptoms pretty shortly after whatever has been taken away from him. He'll start feeling the opposite effects. So for instance, with someone that drinks alcohol, they may start getting tremors, they may start sweating, they may start having trouble sleeping, and they may get irritable. And all these are predictable things that we know happen when somebody gets abruptly taken off of alcohol. And those are called withdrawal symptoms. And again, that's just your body's reaction to being taken off of something. So tolerance and withdrawal is what makes up dependence. So if somebody is saying, hey, I'm dependent upon something, in my mind at least, what I think is, okay, that's a physiological, that's a bodily function. They either have tolerance or they either have withdrawal. And that would happen to anybody regardless of who you are, as I had said earlier. So that's a lot different though than saying that somebody's addicted to something. For instance, somebody could be on pain medicines because they have terminal cancer and been giving high doses of opiates over a long period of time because they have such extreme pain. And I would say that they're not necessarily addicted to the pain pills, but I would say they're definitely going to be dependent upon them, meaning they'd have tolerance and withdrawal due to the opiates. They may be able to use the opiates as prescribed and use them for an appropriate reason for their pain, but they would still have the dependence piece of the opiate use. But they would never really, in my opinion, be addicted to opiates, because addiction implies a whole different set of problems. And that's where I want to kind of focus on now. Basically, if you were to think of addiction as a pattern of use that causes problems, then that's what we're starting to get at when we start talking about addiction. So again, it's a pattern of use that causes problems. Some of the criteria for someone who gets diagnosed with addiction would be such things like they have cravings to use, or they have a really high desire to use a substance. They may also have given up important activities in their life because of their use, or they may not be fulfilling certain obligations that they're supposed to be fulfilling, like going to work and paying their bills. And that's another criteria for someone who is showing signs of addiction. They may want to cut down, they may want to quit, and they have a high desire to do that, and they may have even tried to do these things, cut down, quit, but have not been successful, and that's another criteria for addiction. They may have put themselves in hazardous situations, meaning they might have used alcohol at a bar and drank a little too much and drove home. Or they may have used any other substance and got behind a car. Or they may have been at parties where they've gotten so intoxicated that they really put themselves at risk around other people they don't know well. You know, there's a lot of different ways that you can imagine that could happen. What are some of the other things that would signify an addiction would be that they use the substances a lot longer than they ever thought they would use it, or they use a lot more than they ever thought they would use, or they're using even though they have psychological problems because of it, or physical problems. So say that somebody's using and knows that they're hurting their liver because they're drinking too much, but they continue to use anyway. Or they know that it's causing a lot of trouble between them and their wife or significant other, and they continue to use anyway. So these are all criteria for addiction. And actually, there's a book called the DSM-5, and I'll show you. This is a diagnostic manual that I get these criteria from. You open the book up and you look through, and you find all the criteria that we use in psychiatry and addiction medicine to make the diagnosis of addiction. But I wanted to kind of point out a couple things too when we're talking about addiction. One thing is, you'll never see in the criteria of addiction that has to be daily use. So even if somebody's, I hear this quite a bit actually, hey, you know, doc, I drink a lot, but I don't drink daily, so I don't think that I'm really dependent on alcohol. I don't think I'm addicted to alcohol because I don't use daily. Well, that's not even a criteria in the DSM-5 to make the diagnosis of addiction. It's really more of these other things, these social things like work, not working, not doing things socially, all those other things that we use to make the diagnosis. There are other things that are left out of the DSM-5 and the diagnostic criteria that I think are important when I start thinking of if someone is addicted or not. And these are things that I think that family and significant others of people with addiction will see. For instance, let me give you some examples of that. When somebody's addicted, a lot of times they're behaving in a way that's not really flattering to themselves. They may be lying, they may be cheating, they may be stealing, they may be hiding things from you. They may not be able to be honest about what's going on in their life. They may not be working or doing the things that they used to do. They're not taking care of things around the house, they're taking care of their kids, their jobs. Maybe losing jobs, not being able to go to their jobs because of what's going on in their lives. You know, there's a lot of guilt and shame that these people suffer from. They know that they're probably addicted. They don't know what to do. They get scared. They're just trying to not feel bad a lot of times. They're trying to avoid the withdrawal symptoms, so they're going out and using so that they don't feel bad. They may be spending all their money actually towards their addiction. And that's what someone with an addiction starts looking like, and people really notice that, and they respond in a negative way to these people, because this isn't how things should be. This is not what I signed up for necessarily. A lot of families get torn apart when somebody is addicted because of just all the chaos that can be created when someone's really truly in the throes of their addiction. You probably have seen TV shows even called Intervention, and I'm sure there are other shows on TV where you can actually watch what's going on and what's happening when somebody is truly addicted to things. So of course, I mean, what we're hoping for is that people choose a different way for themselves, and that they're at some point going to either have an intervention or some kind of an awareness that they need help, and that they go and seek help. So when they come through my doors, I'm typically meeting with a person who's really hitting rock bottom or close to that, or really have lost a lot, and they're kind of desperate. Not only financially, maybe desperate financially, may have lost their jobs, but they really do want to be different. They want to feel better. They don't want to feel sick. They don't want to feel totally controlled by the substance that they're using. So when we're talking at least about opiate dependence or addiction, let me be more clear. When we're talking about opiate addiction, there's three different, I guess, ways in which they can enter treatment. One option is that they could go and be on methadone. So there's methadone clinics out there. I'm actually a medical director of the Eskenazi methadone clinic, and they come in for treatment. Or they could go and find a Suboxone provider and be on Suboxone for the treatment of their opiate addiction. They may choose to go through a detox program and get on Suboxone or methadone, and in a very short amount of time just kind of go down on the dose and be done, and do a short detox of methadone and Suboxone and try to maintain an abstinence life after the detox is over. Or they may try to quit cold turkey actually on their own. And if you were to look at the statistics, when you look at those different ways in which you can, approach treatment, and by far and above, the most successful treatments are maintenance treatments, and that's what we provide at the methadone clinic, and that's what's provided when somebody usually gets on Suboxone. It's called maintenance treatment, or medication assisted treatments. And quite honestly, these have been shown over the last 40 to 50 years to be the most highly effective for opiate dependence. The relapse rates for somebody who actually is successful in detoxing off opiates and getting off them completely, if you were to follow them over a year, the relapse rates are close to like 90% of the people would relapse. If you were to look at people with opiate dependence and ask them how many times they've stopped and then returned to using, it would be a very high number as well. So the current medical recommendations are, is somebody really truly has an opiate dependence and they are seeking treatment, that they could be in treatment for the rest of their lives. And that's what I think a lot of family members or people out there in the community aren't aware, is that if somebody is actually doing well in a treatment program, that it should never really be forced upon them to discontinue that treatment as long as they're doing well. So if somebody comes into the Suboxone program, one of the questions that I might hear quite often is, how long am I going to be on Suboxone? And I think that question kind of informs me as to what they're thinking. And I always try to respond by saying something along the lines of, I'm not concerned so much about if you're on Suboxone or off Suboxone. The primary thing that I want to be concerned about when I'm treating somebody is that they're doing well. And so what do I mean by that? Can you be in recovery while on methadone or Suboxone? Can you actually say that? Or a lot of people would say if they go to an NA meeting, hey, if you're still using Suboxone or methadone, you're not really in recovery. You're still addicted to something. And I don't agree with that at all. Now, what I would agree with is that you would be physically dependent upon methadone, or you could be physically dependent upon Suboxone. But I would say that the addiction part of that has hopefully left once you get in treatment and you're on a stable dose of your medication. So when somebody comes in, I tell them that my primary concern is that they function well. And so if they function well and they're on Suboxone, or if they're functioning well and they're on methadone, then I don't really think that they're addicted. The addiction piece of it is, well, are they lying? Are they cheating? Is all their time consumed with finding drugs? Are they not working? Are they doing all these things that they used to do before they got into treatment that was really a negative thing for them in their lives? And if they can say to me, look, ever since I started treatment, my life has changed for the better, and actually dramatically changed for the better. The common thing that I would hear from my patients is like, before treatment, all I did was I tried to find out, who had what, how much money I could get to go spend it. All my time, all my thoughts, all my energy was devoted towards getting my drug of choice and supporting my habit. But after treatment, I don't worry about those things anymore. I feel normal. I'm working. My relationships are better. I enjoy my kids, and I can actually take care of my kids. My husband, my wife, my significant other seems to see a huge change in me. And if they never knew if I were on methadone or Suboxone, they would think that I was just being a normal person, and everything looks totally normal. And so when somebody tells me that, I try to reinforce to them that that's not what addiction looks like, and that's why you can be on Suboxone or be on methadone and not really be addicted. Okay, so I want to make that point. I think it's very important. So the bottom line is, and what I think the correct question would be by somebody coming in to see me is, hey, Dr. Moen, do you think that if I get on this medicine that I'll do better? And I would say absolutely, 100% positively, yes, I think you will do better. If you work a program, this medicine can stabilize you and cause you to be a productive person in your life and in your community, and that you'll see that. Now, if somebody comes into treatment and they don't quit using other things and they're doing all the same things that they used to be doing before they came into treatment, if they're still out chasing drugs and using other drugs and they really don't seem to have made any changes at all in their lives, then I don't think that looks like addiction to me. So yeah, I would say you really haven't got it, and this isn't really a helpful treatment to you. If somebody's on methadone or Suboxone but still doing all that other stuff that I just told you about, then I would say, yeah, you're still addicted. But that's not necessarily what I see. I mean, I know that there are people that don't want to make those changes for themselves, and they continue to do some of their old behaviors and that sort of thing, and I would really say that that still looks like an addiction. So the goal of treatment is, the bottom line is functioning. So basically what I'm saying is, before you came into treatment, you looked pretty dysfunctional. And hopefully once you enter treatment, you become much more functional. And that's really all I'm concerned with. I'm not ever going to push, hey, you need to get off Suboxone, hey, you need to get off methadone. I'm not ever going to really push that. I think that that's something that we can talk about if that's something that you want to do, and if you're stable and you want to come off Suboxone and then you're stable and you want to come off methadone, then I would work with you to do that. But that's never really my bottom line. My bottom line, again, is that you're doing well, that you're functioning well. And so as long as that's happening, I'm happy with the treatment. And I would say that you don't look addicted. So again, I hope that this discussion has at least maybe helped you think in a different way about what addiction really looks like and what it really is and what dependence is. I wanted to share with you also in this lecture something that the government, the federal government, has actually states about Suboxone treatment or methadone treatment that I think that you might find interesting. And this is found in 42 CFR number 12, section G. So if you were really ambitious and you wanted to go look this up, you would go look up 42 CFR section 8, section G. But anyway, I want to read to you what this says. So it says medication-assisted treatment, which would be Suboxone or methadone, is continued as long as benefit is derived from treatment and the treatment is desired by the patient. There should be no fixed length of time in treatment. In fact, indefinite medication-assisted treatment may be clinically indicated. It may be prudent during the course of treatment that other medications be considered as clinically indicated. So summarizing that real quick is that when you are on Suboxone or methadone, the federal government's guidelines is that we don't really say there's a fixed length of time that you have to be in treatment or you should be out of treatment in any certain amount of time. Is that it should be only determined by if you're getting a benefit from it or not. So as long as somebody is benefiting from treatment, that treatment should continue as long as the patient wants. So I want to end by saying that you know, I know it's a hard thing to change some of your thoughts and beliefs about addiction, but I really hope that I can challenge you to think in terms of what really a dependent person looks like versus what a addicted person looks like, because it's a big distinction and there's a big difference. And I'll see you soon. Bring your questions with you to your appointments, and I'd be happy to discuss anything that I've talked about today. Thank you.